A warm welcome to all our viewers, to our series Natural Medicine format. Today I am talking to the head doctor of the BioMed Center Sonnenberg Clinic about the possibility of intervening cancer with chemo or what options patients have to survive or maybe also to seek some way out of dying. So a very thoughtful, exciting topic, which way out do the patients find in the health or illness, and today I am happy that we are taking a holistic look at it from the experience of our Alexandra Kotthaus. Stay tuned. Hello dear Alexandra, thank you for coming. We have a bit of a provocative topic today, really like chemo as a way out or maybe also, you said it earlier, maybe also as a possibility for a suicide in that sense. How did you mean that? We had it in the preliminary meeting.
Yes.
And I would just like to hear that from you again.
Yes, I thought a bit. Let's talk about the possibility of a legal suicide, and by that I don't mean exits, but unfortunately I experience again and again now. Of course I work in a place where patients come who want something, but there are always patients who this may sound a bit harsh, but use the disease to end their life. When it comes to cancer in particular, most people realize that it is a life-threatening disease. There are other diseases that most people are not aware of, which are even similarly life-threatening, or have less good chances of survival, but which neither doctors nor patients immediately associate with the word death. But I experience again and again that there are patients who maybe sometimes don't want to die, but don't want to live, who don't have a clear will to live. And then in the group of patients who don't want to die, there are also those who want to die, but they would never lay hands on themselves, because they can't. Sometimes they say so directly, or also for reasons of faith, but for whom life just got too much, who do not have the feeling that they will get out of their situation any other way, and see no reason to live. And then you have to say that it gets a bit difficult with the therapy.
Is that the situation then somehow still too strong to die and too weak to live on?
I was actually thinking about stadiums before that. So before you enter this stage, but also directly maybe when making a diagnosis. This is sometimes something that many people may not yet be aware of, maybe just unconsciously, but they say, I'll do whatever the doctor tells me now. I do the radiation therapy, the chemo and the operation, and then it's fine. Actually, well, there are enough studies about it that say for those who survive there are several other factors. This came out of a study with a population at about 1,000 survivors or complete remissions from cancer. And one of them is a resounding will to live and taking personal responsibility. And if I say now, just do everything for me, then it gets a little difficult. And sometimes I have patients like that in front of me, do everything for me and tell me now where to go. This is difficult. You can, to a certain extent, use biological medicine, like conventional medicine, so I'll give you something. I take Padma ACB instead of pantoprazole. This is really a substitution therapy. I can exchange it one for one, but it is not a cause treatment. If I want to treat a cause, I might do things differently, but also the side effect-free alternative is the bridge on the way to getting well. So I don't have too much stomach acid. And in that sense I can also use biological medicine. Some patients also have the idea that you have to clarify, we want to treat the root cause, not just the symptom. And then you have to do some things behind it, and someone who wants to survive actually has to change several things in their life.
Now you are a specialist in psychotherapy and psychiatry. And how do you work with the patients? Is there another possibility to check on the level of why do I actually want to live? Why don't I want to live anymore? How are my living conditions? What could motivate the patient again to come into such a joy of life? Because there is often the case that if, for example, the partner dies after 50 years of marriage, the second will actually follow directly within a year. So the psyche really has to play a role.
Sometimes there are cases where the connection is very clear. We have a patient who has been palpating a tumor in her breast for many years. Then there was a quarrel with the daughter, and then this tumor suddenly grew and exploded. And I now know several cases where it sometimes becomes very clear, hey, that's a process that actually has gone on for many years, and then there might be an event, a stumbling block, that something like that degenerates, or grows, or maybe it was already malignant. These are things that are difficult to find out in retrospect. But I don't want to go so far as to say that you can know that with everyone. It's not always that easy to find out. I'm already asking a few things. I'm already trying to hear out how motivated are the patients, and what do they really want. So that we have the whole range up to patients who are almost like, oh yes, it's a malignant tumor, but I'm in good hands with you now and you can do it. Yes, I hope I can.
But it's a nice attitude. Not that you will do everything, not that, but with this motivation that there is a solution.
Yes, and you can say, statistically, these people are definitely living longer. So those who have a certain optimism, who have a positive attitude towards life, they are usually willing to do something. They do the things that they should perhaps implement. And that has always had a positive effect. I can't promise at the beginning that we'll work it out, we'll do a full remission. I can already see that we are helping many people to live longer, with a good quality of life, while the path of conventional medicine can be bumpier. But I'm not saying we know it all, and I'm not saying either don't do chemotherapy. These are things that we talk about individually with the patient. They always ask, some of course also ask for advice. What do you recommend now? Should I do it or not? And then I say, there are 3 conventional medical tumors that have a 95% chance of being cured with chemotherapy. So it's really a good option. One of them, for example, is seminoma, malignant testicular tumor in men, which tends to affect younger people. You could say that they might be able to cope better with the chemo. But even in the advanced stage of conventional medicine, and even in the event of a recurrence, if a recurrence does occur, it can intervene extremely well. We had such a case at the beginning of the year, and we explained all the options to him. You are one of the very, very few cases where I think you just have to know that you can make a good decision. I'm not saying do it or not, but you are one of those cases where, if I were in your place, I would think twice about going the conventional medical route, and we will detoxify you afterwards. He decided against the conventional medical route and actually went into full remission. So that's working too. And there are patients where we take a 2-pronged approach. There are patients who are very clear from the outset that they want both, and then we often see that there are fewer side effects. Or the oncologist says now that was a great success. They say in front of the patient, I wouldn't have expected that. But I don't really position myself clearly towards the patient. I try to do my best for the patient knowingly and conscientiously, to give enough information to enable them to make their decision, because they have to live with the decision. And it wasn't the doctor who said I should do it, or I shouldn't do it. And there is also the other direction, not only now these three which are well curable, but there are also tumors where you simply know, the therapy in conventional medicine is just a straw. So it works so badly that you have to say, does it really do any good to do it? You can judge that a bit more critically. And then there is a range in between. It's really tumor and chemotherapy dependent. And of course, I always want the patients to obtain a normal oncological, conventional medical advice, and have it explained to them what the therapy options are.
In the first diagnosis, some people really go into a kind of shock. And that is then also very difficult to make a clear decision or to be receptive at all. You know it, it's like a phenomenon like fear of exams, or someone says something in front of you and you don't even notice them anymore, what they say at all. And how do you get them out first, so that people are able to weigh up what suits me?
We usually have patients, well, it happens, but it's relatively rare, because by the time they have found their way to us, they will have passed the stage and say, I want to find out more about alternatives now.
Yes, of course, they have already found you.
Or they've had chemotherapy and it didn't work. So we rarely have these cases, but it does happen sometimes. And then you realize in the first conversation, they are still wrapped in a veil, so you can't get to them now. And then it's like that. We have two people that we work with, using different techniques to reconcile soul and body, or to treat trauma with effective methods, so that you get a bit of access again. And then very few decisions have to be made immediately when a tumor is diagnosed, but you can also calm down for a few days and try to regain consciousness, get a clear head, think, okay, I'll get a second opinion, I'll ask around to see what's out there, I'll find out. But we have the opportunity to accompany the patients very well.
So the show is also a bit about maybe stabilizing the patient again, also in the diagnosis phase. Or what was the point for you again to include the topic of suicide?
To have a will to live. Of course there is the possibility of death, and when you deal with people who have achieved such complete remissions, they are often aware of it, they are often not afraid of death. So the topic of fear also plays an important role, because fear can incredibly negatively affect my system. But there are techniques where you can even learn relatively quickly to get rid of it. But there are also people who are generally a little more anxious, but who have often overcome the fear of death, and still have a very clear will to live, have a very good reason to live and to live on. It's the same with healthy old people when they have to take care of their grandchildren. Then statistically, they live longer than those who have no grandchildren. So these things play a role, and a lot of people, I said it once. I don't even know if it wants to be watched, but I would like to do a show which is called, How Do I Turn 100 and Do I Even Want That? And that's where we come into an area that doesn't just affect cancer patients, but I see more and more people who try to make the best of their lives, or to live beautifully, but for them leisure time is value and enjoyment in the sense of, I want to go out to eat, I want to drink wine. That has such a high priority, I would almost like to say as a substitute satisfaction for deeper satisfactions in life, and they're not ready to limit themselves, so they can grow old. So they can maybe live to be 100. Because most people have the picture in their head, then I'm demented, or then I'm lying in bed, and then I'm no longer independent and dependent on outside help. And that doesn't have to be mandatory. but they have a terrible image of old age in front of the inner eye and maybe sometimes live in an unconsciousness that one can say, guys, you are sawing so mightily on the branch you are sitting on. For me, if I want to be 100, then I also have a deep will to live in me, and then I live like this, that I'll still be as fit as possible at 100. And then I have the option too to lead an intense life, a conscious life. I don't mess with my, so to speak, emotional household with certain foods that also biochemically temporarily cause satisfaction, or sometimes make dopamine release in the brain, but on a completely different, much deeper level. I can lead a satisfied, loving, intense life because, for example, if I live well, live healthily, live consciously, my body is much fitter. I can also go up into the mountains longer. So also participate more intensively in life with my body, or have sex until old age. Stuff like that, and these are things for me that all belong under one roof. But if I don't see what's worth living for, I know enough people who are still healthy or can still actively participate in life, but who do not see this deeper meaning in life.
Maybe it's also due to the generation that really learned to function and to achieve something in life. And the really deep, true calling certainly didn't play a major role there, but rather the framework. See that you become something. That's what people are like, who might say, I'll be glad when it's over.
Yes, exactly. People who say I am overwhelmed in my professional life, and my free time is for having fun. Actually, the free time was there to relax, so that I could be productive. Free time is now for fun. I don't feel like I treat myself by eating something good now, but I feel like I treat myself by somehow drinking a bottle of wine every night on vacation or something. That is now equated with enjoyment. I have to do this and that in my free time, or go to the gym and stuff like that. So fun.
If I live my vocation, then I don't need a balance either. Then there is no work-life balance in the sense, because at that moment when I live my calling,
I don't have to get this substitution or something in my free time. That's true. So if my husband were to hear that now, I'm thinking right now, he will now say hello, wait a minute. He always takes care of me a bit so that I don't work too much and balances things out, but balance in the sense, well, my job as a doctor is now such a sedentary occupation. I am a desk clerk, not exclusively, but for the most part of the day. And then he makes sure that we go for a walk, that we go hiking, or from time to time get on my bike or something, here in the Appenzeller land, mind you. So that the body is also served. Let's say, I once read a book 20 years ago or so. Someone wrote, let's just imagine we have different containers within us and we need to serve all containers so that we can have a happy and healthy life. It starts out with vitamin F, like family. That means we have to take care of our bodies, which includes a certain amount, or at least a moderate amount of exercise, but also do something for a moment that gets your heart rate up to the limit. That's good, little stimuli like that. That means I have to maintain and serve different areas in my life in order to benefit for as long as possible from having a healthy and beautiful old age worth living in.
if finally a patient really comes to you and says, okay, somehow I feel I want to survive, but I don't have the strength right now, and I feel I'm in a depression or in a heaviness that just doesn't allow me to motivate myself in any way.
Ich bin in einer Depression oder in einer Schwere, die es mir einfach nicht ermöglicht, jetzt in irgendeiner Form mich zu motivieren.
Now, of course, I know from our preliminary talk or from other interviews that you have opportunities to detoxify the patient physically, which in turn has an impact on the mental detoxification, so that you really say, hey, I'm on the ground now and I'm overwhelmed with the diagnosis. I don't need someone to heal me now. I need someone to clear me out, so that I can be mentally healthy again.
Nicht jemand, der mich heilt, sondern der mich mal entmüllt, damit ich mal geistig wieder gesund bin.
What would you recommend to the patient, or how do you support them at this stage?
Wie begleitet ihr dann gerade auch in diesem Stadium?
Or you really have friends or relatives who say, hey, come on, do that now and then we'll see how it looks afterwards.
Yes, you're right, it's an interaction, or treating depression, or something like this is an interaction of several pillars, several forms of therapy. The detoxification, of course, plays a big part for the tumor disease and the depression. But sometimes, obvious mental injury is behind it. Sometimes maybe less obvious, but I don't want to say that it always has the same weight. So when I say we have so many factors in life, containers or vitamins that we need to fill, then for some there is more of a deficit here, and with the other there is more of a deficit there. From time to time, I have of course also more psychiatric or psychotherapeutic talks with my patients. There is usually always a conversation where I try to find out, where does someone stand spiritually? How firmly are they anchored in their faith? What do they think? How does it go on after death? Are they scared or something? But we have colleagues who do that, and then it's not my job, because I actually mainly treat the body as well, even if the rest is part of it too. However, my conversations are more about nutrition, what therapies, fine-tuning of the micronutrients, or things like that. And then the other parts are scanned too, and then it's very clear. Their job is very clear, the colleagues. They don't have anything and they can't ask any questions in between. Can't you still do that or do this therapy? But there's a different frame for them, a different space where they can work, where they can solve traumata, are able to work on obstacles to healing. So the possibility exists with us as an entire institution.
Fine, great, so thank you very much that you were here again today. Our time always goes by far too quickly. We could, as I always say, chat for hours. But I really think it's exactly that. Certainly the valuable thing is that since the patient has the opportunity to get out of the first hole, in these different ways with the psyche too, with the traumata that are certainly also hidden under many illnesses, whether consciously or unconsciously. Then I hope that you will come back soon, and thank you for being here.
Thank you.
Dear viewers, it's always wonderful that we have people, and above all doctors, who have this far-sightedness and enrich us again and again with different facets, also for healing or for diagnosis and therapy options. And thank you for watching. Have a wonderful time and see you soon. Bye.